with Dr. William Pelham Jr., Professor of Psychology and Psychiatry at Florida International University and the Director of the Center for Children and Families. Dr. Pelham will be talking to us today about attention deficit hyperactivity disorder. Thank you for being with us.
Thank you for inviting me, Tuma.
So the first question I have is, how does a parent know if their child has ADHD?
ADHD has long been defined as having a set of symptoms. The symptoms are common aspects of the way children behave and the way they act and think. Inattention, problems paying attention, problems with impulse control, and problems with activity level are the three core characteristics of ADHD. That means a child is not finishing things he or she starts at school or having trouble finishing homework, a child interrupting other people a lot, answering questions before they're done, or interrupting other kids in games and that sort of thing. Those are the DSM, that's a Diagnostic and Statistical Manual. Those are the definitions of ADHD.
And who can make a diagnosis of ADHD?
A diagnosis, if you followed the DSM procedures, they're pretty clear-cut. A psychiatrist, a psychologist, a school psychologist, a social worker, a pediatrician, all sorts of people can make a diagnosis. And even parents can find on the internet lists of the DSM symptoms of ADHD. But it's much more important for a parent to think about not what the symptoms are, but what the problems in daily life functioning are. There are lots of kids who have symptoms of ADHD. 2-year-olds, almost every 2-year-old has all the symptoms of ADHD. But as they get to be older, then most of those go away. And the symptoms are only important if they occur a lot more than they do in a child of the same age, and if they cause problems. So the problems that are typically characteristic of ADHD kids are problems getting along with other children, getting into fights, disrupting games, with the result that the child doesn't get invited over to the other kids' houses in the neighborhood, or doesn't get invited to parties at school, problems functioning in the classroom at school, and causing disruptions at home with siblings, with parents, and so forth. And it's those problems in daily life functioning that are the most important things for a parent to think about fixing.